Hello, good evening, good evening, good evening. How are we doing? I hope we've had a good day today. And I trust everyone's doing well. Good evening, good evening. How is your day been? I trust very well. I trust we're doing great. Hello. Good evening. Good evening. Today we're talking about some important topic it's important and it's close to my heart. Well, actually, I'm living some of it, so I'm gonna wait and let more people join in, and then we can get cracking on. Actually, we still have like a minute, so hello. Good evening, good evening, good evening. Oh God, it's 7 o'clock already. Good evening, everyone. Good evening. I'm just gonna get cracking with this. Good evening. I can see all my friends that we're having this conversation with tonight are joining. I'm gonna give you like a minute more and let more people join. But in the meantime, quickly, I'm gonna bring you the word that I have today. It's Psalm 32:8. I will teach you the right way to live, and I will be your guide, and I will take care of you. And it's a word for me personally that resonates. Well, I can't speak now. That resonates with me, in this season, and it just for me is about the amazing love of God and His promises, and I believe His word, and so I just wanted to share that. But hey, October is Menopause Awareness Month, and I couldn't let the month go by without having this conversation, honestly, because I thought, even if it means that it's going to be the last day of October, we're going to talk about this menopause thing. As someone going through it myself, honestly, I understand firsthand how much it will help to speak about it openly and honestly, and I have some friends we meet today who are joining me in this conversation, about menopause. I'm going to try and bring them in. Um, hello. Um, um,
Hello. Hi.
Hi, Miss Soma, how are you? Hey,
Hi.
hi,
Fine, thank
Paula,
you.
how are you?
Thank
How
you.
are we
Thank you. I'm fine.
doing?
Good. We're okay.
How are you, Paula?
I'm good. I'm just on a shift today, so it's been a bit of a rush, but I'm here. I'm
Oh,
here.
bless. Thank you for joining.
No, it's
Um,
fine.
I was gonna wait for a few more people to join, but as I was saying, honestly, thank you, ladies, for joining. I'm saying I've got my friends here. We're going to be talking about this, and even if it's the last day of October, let's talk about this
Mm.
menopause thing, and it is a real thing. Thank you, everyone who's joined. Thank you for joining. Today we're talking about embracing the menopause journey with confidence, and we're going to be talking about discussing what to expect during menopause. I still have another friend who's joining, so I'm gonna um just try and give it another minute or so, and then but we're gonna be sharing tips on managing menopause and what we've been doing. It'll be good to share honestly and openly, what's affected us, and mindset shifts also for well-being. And I also quickly wanted to bring another word, which is getting wisdom is the wisest thing you can do. And whatever else you do, develop good judgment. Another version says wisdom is a principal thing, and therefore get wisdom. In all you're getting, get understanding. And for me today, wisdom is seeking your options to wellness in the stage of menopause that you're in. Seeking the truth and the fact findings, honestly, and that's wisdom. And understanding and good judgment for me is doing your own due diligence. Know which option is right for you, because every woman is unique in their situation. And so not all options are right for you, but doing due diligence to see which ones are the right options for you, and then engaging the right option for you with the truth that you know, the help of the healthcare professional, and then the Spirit of God in you, which will lead to wellness. That's my perspective on this matter. While we're waiting for my other friend, I'm gonna introduce um Dr. Omar. I've got Paula. I'm gonna let you introduce yourself properly and what you do. And while one thing we have in common is this menopause thing. So I'm gonna let Miss Omar, I think Paula, you joined first. I'm gonna let you go first, Paula. Introduce
So hi,
yourself.
I'm Paula. I'm a registered nurse, learning disability nurse, with a special interest in holistic menopause, um, yoga teacher, and also a menopause coach.
Amazing, amazing. Thank you, thank you. Then if you go, Dr. Omar, please introduce
Hi,
yourself.
I'm Kazalo Umar. I'm a consultant gynecologist. One of my special interests is menopause and treatment of the menopause. Hi, Paula. Nice to see
Hi.
you. Hi, nice to see you. It's
Amazing.
good.
Lovely to have you both here. And thank you for joining me tonight in this conversation. And let's see, first of all, before I carry on, I'm just going to tell you a bit about FHF. We're the Feminine Health and Fiber Support Network, and we're a support group that encourage conversations and provide solutions concerning feminine health issues like fibroids, endometriosis, myomectomy, hysterectomies procedures, and menopause, which we're talking about today. And also, I love to talk about alternative treatments and using food as medicine and lifestyle choices. And that's who we are. We're a charitable organization, and we're community to help inform and educate women, handholding, making sure that women, get support. And we're also advocates creating awareness regarding feminine health issues. So today we are talking about embracing the menopause journey with confidence. You know, um, Before I get into the questions, honestly, I wanted to talk about some of the stats. The menopause stats. There are facts out there, and I am a strong believer of you have to know the facts before you know how to tackle what you're going to be dealing with. And then with the facts also, you have to know the truth. For me, the truth is what the word of God says against what the fact is. Know the facts, get the truth, and then you start a journey of how to engage. Is how I deal with it. So um it says that up to 80 to 90% of women will have menopause symptoms, and about
Mhm.
25% will will describe them as severe and debilitating. Clearly, this is a serious thing. It's a serious matter. So, um, you are the well, Dr. Omar. You tell
Mhm.
us a bit more about menopause. What is menopause?
Menopause
What? Yeah.
is basically there is menopause and there is perimenopause.
Okay.
So those two, the perimenopause, which usually started in a fourth decade of life from 40 and above, and that leading to menopause. But
So
perimenopause,
is
yeah,
there an early peri and late perimenopause, or is just that you?
there are many of the women started from age of 45 and above,
So is
but
that
there are
early?
still no. No, perimenopause is starts because the average age of menopause is 50 to 53. So
Right.
perimenopause is basically start from perimenopause is start from 45 and above, and early menopause can start from 40 to above. I mean 40 to 45.
Wow.
But before
Mm-hmm.
that, we call it premature menopause. Those unlucky people, there are also premature menopause. It's basically gradual cessation of the ovarian function and
Mm-hmm.
ovulation and reducing the amount of the estrogen and testosterone hormone in the female body. And will impact on all the symptoms which has happened during menopause or perimenopause.
Right. Right. So that's reduction of less estrogen is less produced in the
Yeah,
body,
or
as the woman
or
approaches
diminish, or
menopause.
absolutely stop, and it becomes too low, and then the menopause starts. But the menopause by itself, the women we
Mm-hmm.
call it menopause if they have no period exactly for 12 months. That will call it menopause, complete menopause. And also we have a surgical menopause, which is taking the ovary away. The woman will be menopause within very short time after the surgery.
Okay.
So,
Actually, I have a
well,
question for you about
yeah,
that
yeah,
later on,
mm,
but we will get into that a
mm,
bit later
yeah,
on
yeah,
because, yeah, I do have a question about that. Okay.
yeah,
So
yeah,
thank you for helping us understand a bit more what menopause
mm,
is, But for most women, well, I speak for myself, it's also what comes with either menopause or even when you're in menopause is all of those symptoms that
yeah,
you don't know what's going on with your body because your body just behaving differently than you're used to,
yeah,
you know and
yeah,
Shola is saying she's trying to get in. I don't know why. Anyway, it's behaving differently than you're used to,
yeah,
and so today I wanted to
mm,
also talk about some of those symptoms,
mm-hmm,
if that's okay,
yeah,
and also some ways of alleviating those symptoms.
mm-hmm,
And then also we can share personal, like Paula, you can share what you've done, how you've dealt with your situation. I can share some of my, recently I was in a very bad state, even with that joint and stuff pain. Anyway, so
mm-hmm.
I mean, if we start like that, and well, some of the most common symptoms, include insomnia, low
So,
energy
so
level.
we have to divide it. It make people more understanding. We
Okay.
have to divide it to three parts because not every woman have all of them or have part of them. The first thing is a physiological or physical change.
Physical
The
change.
second one is psychological, and the
Hmm.
third one is sexual. So
Okay.
these are the things which, as you said, can start with hot flush, sweating,
Hmm.
what is called vasomotor symptom, which is affect the dilation of the blood vessels and causing most of the women start with hot flush, sweating,
Okay.
and that
So
making
that's the
them
most common symptoms.
very common, very
Okay.
common and early symptom. And waking them up in the night, they feel very hot, then sweaty, then they feel cold. So also at work, they feel very quickly they are. And I had women when they come and they say, please, can you open the window while it is the middle of the winter? So, so hot flush and sweating is very, very common. And that can cause also one of the part which cause insomnia.
Okay.
Cannot sleep very well because waking up, sleeping back is a bit difficult, but has other causes of insomnia also.
Okay. So you just answered the first question that I
Yeah.
had for you. So these are the early signs and
Mm,
symptoms to look
mm,
out for. But you've also
yeah.
said we need to divide that
Mm,
into three parts: the
mm,
physical one, the
mm,
psychological one,
mm.
and the sexual one.
Yeah,
Mhm.
yeah.
Not like mood changes though, because I mean, I
Mm,
think some people, I work with women on the female estate, and
mm,
we've got women talk about low mood,
yeah. That's the
anxiety.
psychological side of it.
It
Yeah.
is, it
Mm,
is.
yeah. Yeah.
Interesting.
Mm,
Amazing stuff.
mm, mm,
Amazing. You, Paula, if you're okay to share, I
mm,
mean, what were your own early
mm,
symptoms? How
mm,
how did it get started for you?
mm,
So getting started, I think I noticed the very early signs in my very early
mm, mm,
40s, and that were around weight gain, mood swings,
mm,
irritability.
mm,
But I was exercising a lot, so for me, 40s, early 40s, running, doing loads of exercising, lifting weights and things. So I didn't really sort of connect the dots with it being sort of like even thinking about the menopause. I think it was just before lockdown, sort of like 2019, 2020, when I really noticed like irritability, period changes, going to the toilet a lot more, sleep issues. So yeah, I didn't have loads. I think I had about 8 or 9 symptoms. I know some people say there's 40, 50, 60, you know, there's loads of symptoms, but I didn't have, you know, loads of symptoms that were really sort of key. Mine were like, so then I started tracking my periods and noticing that they were sort of hit and miss. So that's when I started to more, in lockdown, really start connecting the dots as in what was really going on. Yeah.
Interesting. Interesting. I mean, so with me, actually, like you, I didn't even connect the dots, but yeah, irritability, I had that. I had night sweats, you know, and I just used to think, what is going on? One minute I am, you know, cold and I'm shivering and I need covers, and another minute I'm like, open the window, just throw this thing away from me, and I didn't understand. And yes, I had irritability, a lot of it, you know, and that for me was the Perry. So I'm just gonna let Shola come in. Sorry. You know, for me, I had lots of irritability as well, but I didn't even know what it was. I was just like, what on earth is this? And I was just trying to cope and all of that. But after I had a procedure, which I had a hysterectomy, you know, and things started changing for me. Like, okay, am I menopause? Now I started looking into it a bit more, and I had other things. My leg used to hurt, you know. I was always going to the toilet. I was like, what is this? Is something wrong with me? You know, so for me, those were the early signs. Definitely irritability, the night sweats, and the hot flushes for me. And headache, actually. I had a bit of headache as well, which was constantly like something's going on.
I didn't get the headache. I did get some palpitations again that were 2020. I was getting some like palpitations, and you start to think, am I having a heart attack? But it wasn't. It was just because of like the doctor said, the estrogen starting to reduce, and you're starting to feel these other things going on with the body. Yes,
absolutely. I have a story about that. There's a family friend of mine who she was having this heart palpitation, and she thought she was dying. She was like, "Okay, we need to go to A&E," you know, and she just like, something happened. I think I'm having a heart attack. And she went to A&E. She made a lot of fuss and everything. And after the checks and everything, like, there's nothing wrong with you. And I know I'm dying because this is not stopping. And then when they told her, they think it was menopause, I was like, yeah, you kidding me? Like, I'm not dying then. Yeah. Honestly, that one, I didn't have that actually. I don't think I had that. I can't remember having that. But yeah. The heart palpitation is a thing for some people. Absolutely.
And anxiety is very common because people, they think someone and unfortunately it is especially perimenopause start when your children are teenagers, and then you are worried about them. They go out, they take your permission, and you know where they are. Every minute you are anxious about them, you are starting to text them, to phone them, then they put the phone off, then you are very, very worried there is something has happened. This is all about the anxiety which has happened during menopause. And imagine teenage and perimenopause mom, and how the man is going to cope. And also this is the middle age crisis. This happened before. They call a middle age crisis because these all join to each other and then become a fight, become very angry for nothing, or you start crying without even know why you are crying for, and then you start apologizing, but you don't know why you did that. So
I know. I mean,
yeah,
my son used to ask me why I was always so angry. Like,
yeah.
I'm not angry. I'm like,
And
no,
angry,
you are
yeah,
angry.
yeah. You get
Why
more
are you
angry.
angry?
Yeah, you get more angry. Or
And
why
I
you
couldn't
shouting?
understand.
Or
In
why
fact,
you shouting? Yeah,
recently,
yeah,
I mean, I played a video, you
yeah,
know, and I was like, really? Why
yeah,
was I shouting?
yeah,
And he said,
yeah,
I didn't understand why you were screaming at me
yeah.
as
And the
well.
other thing
Honestly,
was
yeah.
saying, then they start telling you why you shouting, and that is more triggering, more shouting. And you say, I'm not shouting. So these are the things which later on asking yourself why I have done that. So this, unfortunately, in the past, now media is very common. People knows about it. But imagine 10 years ago, 15 years ago, even 15 years ago, people were really shy to talk about the menopause or had no knowledge. Thank God nowadays I see nearly 5-6 patients in a day. So it is common, it is known, and also it is available, whatever the help is available. So these are, and also foggy brain. You put something somewhere and you can't find it. It's supposed to be in a good place to remind yourself, and then you can't find it. And the time when you need them, you don't know where it is. And
Yes, the
at
brain
work
problem.
now a lot of women I have seen, especially the bankers, the finance people, they've been taking really a time off because they've been blamed for the wrongdoing and foggy brain. And they are in the meeting. They are in the meeting and they forget what they have to say. So these are perimenopause. Even if not menopausal, it is perimenopausal. Yeah. And the other thing, which is body ache. Most of the patients of fibromyalgia, believe me, are perimenopause and menopause. Being diagnosed for fibromyalgia and been given lots of pain relief, but it is the body ache, joint pain, all because of lack of estrogen. So these are the things which has to be highlighted, has to be think about it. It depends on what the GP is going to think or what specialty the GP is going to refer the patient. So if you refer to rheumatologist, of course, straight away say that's fibromyalgia, but it's not fibromyalgia.
Wow. And it's just menopause.
No, it's menopause.
Honestly, some of the symptoms. That's why
Mm,
I'm a believer of having this symptom checker thing, handy, and just
mm,
understanding
mm,
what your own combination of
mm,
symptoms are.
mm, mm, mm,
And I'm also
mm,
big on the supplements. Before
mm,
we even start to talk about
mm,
supplements and all of that,
mm,
and
mm,
then you can share what you've done, but the thing about
mm.
how this
It's fine.
impacts, how it
Mm,
impacts
impact.
women
Impact. Mm.
on a daily, or just the day-to-day life
Yeah, yeah,
activities
yeah,
is worrying. I remember
yeah.
for me with the foggy brain thing, it was beginning to affect my confidence at work
Mm,
because I've always
mm,
been like a
mm,
project manager, delivery
mm,
manager,
mm.
managing
Yeah,
number of teams. And
yeah.
I go to meeting and I'm just blank and I'm thinking, what is wrong with me?
Mm,
And a
mm,
lot of women are
mm,
dealing with that. And sometimes you're feeling anxious, like, what's
mm,
going on? Am I losing it? Can I not do
mm.
my job anymore? Can I not
Yeah.
work properly
Mm,
anymore? And also some of the things that will be good to also address,
mm,
how we also can affect women psychologically
mm,
and
mm.
and get to that. But let's keep going. I'm gonna ask. I tried to let Shola in, but for some reason she's not able to come in. The other question I have is maybe that will help us get to some of the supplements, and
Mm.
then
It
it's
depends. It
around.
depends. Supplement is depend on what you're suffering from. And the
Yeah,
other thing
that's what I
about
am
so
realizing.
we have to first to know what is the main problem with each one and how to help that problem is not happening. For example, lots of people, they start crying, oh my God, my hair is very thin. And then now I'm losing all my hair.
Yeah.
And so they go to specialists about the skin and things like that, or changing from one shampoo to another, spending a lot of money of the expensive shampoo, and it is a menopause. It's not the just suddenly all the hair is falling down. You lucky girls because you have a good connective tissue. You know how the skin is affected. You are lucky. You have a very good connective tissue. So that is not in your side. This is in your side where the skin is become saggy, become wrinkly. The face, you look on your mirror and you say, oh, is that me? So, and then you start thinking, Botox, filler, whatever there is available. That's why all the salon is working very well because of the
But I think
because of the medical.
I think that you've got got to address that. It's lifestyle, isn't it? Because what you meet with
Yeah,
people don't want to give up sometimes
no,
alcohol, cigarettes, and things that
yeah,
age you
that is the
prematurely.
lifestyle is very important.
Sugar,
Lifestyle
No,
is very
lifestyle is
important.
key.
Yeah, it's a
keep,
key.
yeah,
So if we
yeah.
know this is coming, that is important, because if people does think that they are immune from age of 45, they will not be perimenopausal or menopausal, then they don't change the lifestyle. But if they start lifestyle from the very early time, as you say, the alcohol, a lot of hot drink like coffee, tea, fizzy drink, hot food, very spicy food, all
Yes,
these,
spicy food. Yeah.
yeah, I know, spicy food, all these will help for the hot flush and sweating. And also, if there is any estrogen in the body, will not be lost, because it's not only the estrogen we have in the adrenal gland over the kidney. We have a testosterone. Also, luckily, testosterone can change to estrogen, still can give a little bit. So if we damage it by the lifestyle problem and alcohol and 10 cups of coffee or tea and hot drink and sparkling things, this all will be damaged. So we have to be careful. Yeah, yeah, definitely we have to be careful.
Okay. So that also brings me to, so knowing, okay, when you understand around the age that menopause is supposed to start, that's I presume is when you start to change your lifestyle, and that is that when you also start to top up on supplement, or you just wait until you get the symptoms to start
It's,
to.
I don't think it's about supplements. It's about eating good food, isn't it? It's about knowing what
Mm.
eating seasonal. So like colours from the rainbow. You know, some people stick to certain things, don't they, because it's a tradition. But you've got to start sort of like looking at where you can get like magnesium, your vitamins from, oranges,
Mm.
you know, apples,
Mm.
green veg,
Mm.
potatoes. You've got to eat just abundance of the rainbow of kale,
Mm.
spinach. You know,
Mm.
you've got to start, you
Mm.
know, like your cauliflowers. You've got to put everything in there. You know,
Yeah,
peppers, onions, garlics. You've got to put everything in there. You've got other
yeah,
things that you could use, like some people like to balance the gut. So you've got to balance the gut as
Yeah,
well. You've got
yeah.
things like kimchi. You've got lots of other things that can balance the gut.
mm.
Because if you don't balance your gut, you're out of sync anyway.
Mm.
You've got to
Mm. Mm.
eat well before
Yeah,
you supplement, and you've got
and
to look at what you can eat
and
well. Protein,
vitamin
carbs,
D,
healthy
vitamin
fats,
D is a key also. Vitamin
vitamin
D
Vitamin
D.
is a
D.
key.
Yeah, vitamin D.
Yeah,
Yes.
is a
Okay.
key. Is a key. A lot of the symptom I have seen women come in as look like menopausal, perimenopause symptom, and they have vitamin D deficiency, and it gives a lot of problem. People they don't understand. We knew that during COVID, the people with the vitamin D deficiency they have more complicated COVID infection than the one which don't, because
Right.
it is supportive. Is very very supportive. Because even if there is a sun, we are covered, or we wearing
Mm-hmm.
black. So we have to tell the women wearing much lighter clothes, no woolly jumper, no thick clothes, layers, and linen is very important. Even, you know, we have a habit, we change the duvet from the wintry duvet to a summery one, or summery one to, don't change it to winter one because it will be too hot. So it's better to be changing the linen very, yeah. So it is important, the pale color, the light color clothes, and also layering. When you hot,
Layering,
take,
definitely.
take off the layers, and then you feel a bit cooler. And cold drink is very important, and no late shower. You know, no shower before you go to bed, because that is very hot. So it's better to be early evening to cool down your body before you go into bed. Because some people, they just before they go to bed on their 30s or 20s, they had a shower just before go to bed. You should not do that because it is hot. Yeah, so that cool yourself down by cold drink, not hot drink. Although at work you always been offered, do you want a coffee? Do you want a coffee? Can you don't tell me, please? That's enough.
I love me. I love me a lot of coffee. Yeah.
Coffee. I know, I know. So the lifestyle is very important.
It
Lifestyle is,
is.
yeah,
It
it's very
is.
important.
It is.
Yeah.
And I
Mm,
and I agree honestly.
mm,
And also, but having said that, I mean, I know you know, Paula, you've talked about eating well and eating right and all of that. I'm not saying that I eat
I've,
well.
I've
I eat well all the
supplemented.
time or
Yeah,
what.
yeah.
But
I've
recently,
supplemented. Yeah,
Yeah.
yeah, but
I've taken
recently,
I've taken ashwagandha
Mhm.
through the early part because of the symptoms I were having. I took ashwagandha. I bought a real good grade of ashwagandha, and that's sorted me
so
out,
what
helped me no
was the
end.
symptom that you had
So
that you
that
thought to use after
for the panic
supplement?
for the anxiety, the
Anxiety.
panic attacks, for the sleep issues that I was experiencing, I took that because I wanted to be more on the natural side.
Mm.
Mm-hmm.
Yeah,
And
and
Interesting.
it helped with
soya.
the hot flushes.
Soya also have a good amount of estrogen, natural estrogen, but not
Mhm.
soy sauce. Milk, yogurt, and soya bean. But soy sauce, because they put a lot of things in, so it damage the estrogen, natural estrogen on. But milk, soya milk and soya yogurt and soya bean is very good because it has and your yam, it has also.
Yes, okay. But
Yeah. Yeah.
so this is
But
where
unfortunately,
this
it's
is
a carb. It's a carb.
but this is where your unique situation comes in, because if you have fibroids, you don't want to touch those things.
Ah.
That's another problem. That's another problem. So
Mhm.
we leave the fibroid group in the other side. We don't tell them that. Oh
So
my God.
that's honestly, and for me, and that's why I say
Yeah.
every woman is unique.
Mm,
It's
Find
different.
your
Yeah.
the combination of
Mm,
the stuff that will work for
yeah.
you, and that's what you should engage. Honestly,
Mm,
is there's
mm.
no one hat fits all.
no, there
No.
isn't. No one
No.
size. No.
No.
Yeah, and then
No.
there's this, you've talked about ashwagandha. You know, I
Mm,
have a friend who swears by it as well, because, well, she used to have a stressful job and all of that. I
mm.
mean, I think I've only taken that a few times, but something that I has worked for me a lot is that magnesium powder from Holland and Barrett. I cannot
Very
even
good.
lie, because there are times that, you know,
Mm.
I don't feel my joint. I don't feel like I own this body, but if I consistently do that, put I can have a teaspoon in water and drink like 3-4 days, I feel good.
That's good.
So magnesium does help work for me. It helps
And
me a
zinc.
lot. Hmm?
And zinc. Zinc also good.
Okay.
Zinc also good. Yeah. Zinc also good.
Mm.
It's different from one person to another. You see that
Yeah.
some of the people, they say, Mom, don't touch me. But be in mind, when you eat well and everything, you name it as seasonal thing, they all also have a lot of things in.
Mm-hmm.
So you have to be careful not to be, for example, I have women, they come in with taking lots of multivitamins,
Okay.
B12, and then they eat also good food, and their B12 in the sky, they cause similar menopausal symptom,
Oh.
neurological. Oh yes, high B12 is cause damage to the nerve. They get insomnia, they get irritability and anxiety. I had a lawyer. She was 38 and she came to me and she said, I'm menopausal. I said, I don't think so. What do you take? What you take? She said, this. I said, can you go and do the B12? B12, the maximum is 771. Her one was
Oh
2,500. So,
wow.
yes. So I said, just stop it. Imagine, took her 1.5 years to come down.
Oh
She
wow.
was taking so much because people take a lot of supplement also, but they don't know what is the content. They don't read it. So it is 2-3 tablets in a day, and each one of them have the same amount of that.
Yeah.
So
Yes. I mean,
you
I
have to
I
be careful.
I
Mm,
had to learn that the hard way as
mm,
well, because I
mm,
used to like to
mm.
put, there's this vitamin C with zinc that I like to put in water. There's this
Yeah,
um
yeah,
I like
yeah.
to drink, but then I would
Mm,
still take multivitamins. And I
mm,
noticed that I will be having severe migraine or something
mm,
not just
mm,
right. And then
mm,
one day I thought, you know what, I should read this stuff. I'm like,
mm,
oh God, I'm already
mm,
taking
mm,
3,000, vitamin
mm.
C, and my
This is too
um
much.
my
Yeah,
multivitamin has that as well. And
yeah, yeah.
yeah, it's really
So
important
you
that
have to be careful with what you take in, and you have to be careful what is the supplement. And also, there are a lot of things which is in a Chinese shop for the skin people. Be careful because it can damage
yeah.
the. That's I even forgot the names, to be honest. There's one of them damaged the liver.
What's that?
A black
Ooh.
blackish.
Yes, yes.
Will damage the liver. So you have to be careful what you're taking and what's contained. And some people, they order over the internet. I had a lady, she had a fibroid and she continuously bleeding. I said, do you taking anything? She was taking hormones. As you said, you have a fibroid, you can't take estrogen. She was taking over the internet and her fibroid was becoming bigger and bigger and bleeding. So it is, you have to be careful. I asked that question. First thing, what you taking? And they think I'm talking about medicine. I say, no, what supplement you taking? Do you order it over the internet, anything? Because sometimes it is related. It is related. So, but there are some women also, they have a fight with their husband. They say it's menopause. No, it's not. No, it's not.
I don't know about that, but menopause,
Yeah.
menopause to get out of anything. But honestly, it's real issue that's affecting women's life, honestly, and everyday today
Yeah.
life. It affects our relationships, our social life, you know.
Yeah.
And like I was saying earlier on with the foggy brain,
Mm,
you know, that for me caused me a lot of anxiety at work, you
mm,
know, and it was only
yeah.
because after a while I found out there was like a menopause cafe at work, you
Yeah.
know, lunchtime. So I will
Yeah.
go. And then
Yeah.
after that, I started because I was feeling inadequate at some point at work. I'm thinking, I
Mm,
don't think I know this work anymore. I think I'm losing the touch
mm,
and all of that
mm,
because I didn't kind of link it to all of the
yeah.
menopause stuff
Yeah.
and whatnot. But when I started going to, those are the things that honestly
Mm,
there should be in the workplace, you know,
mm,
support for women. So I started
mm,
going to this
mm,
the
mm,
menopause cafe at
yeah.
lunchtime
Yeah.
and started finding things out and also knowing that look, it was okay to talk about this
Go
thing,
to
and
talk
then it gave
about
me a
it.
bit more confidence. So after I go back to my team, I'm like, okay, just in
Mm,
case
mm,
I
mm,
put the word out there, this is my
yeah.
situation right now, and just in case you tell me something as your
Mm,
as your manager, I don't remember tomorrow when we do stand up, please bear with me. You know, I just put
mm,
it out there. And then that way I was feeling a bit better. I'm like,
mm,
okay, it's not like I'm silly or I don't know my job
mm,
anymore. It's just because of what's happening. And some people are understanding, like,
mm.
oh, we said that yesterday. I'm like, can you remind me, please?
Yeah.
You know,
Yeah.
and you
Mm,
just
mm, mm,
get in, knowing that it's okay, and as long as you let people know what
mm,
the situation is,
mm.
and then that way people can understand or get at least
Yeah.
be aware
Mm,
that
Of
with what
of
you're
the
dealing with.
situation and what you're going through.
mm,
Yeah, I think
Yes. And honestly, I didn't get that confidence until I went to a menopause clinic at work a few times. And I thought, okay, you know what? I'm going to let people, my team know that this is what it is. And just in case I forget something or I don't remember what we shared yesterday at the meeting, please be kind and remind me. I am sorry. And I started taking notes. I started, you know, recording stuff, whatever it is to just help me, you know, do my job better and all of that. So honestly, it's all of the coping mechanisms,
yeah,
and that's where a support group or a place where women can go and get the help and the support and have conversations so they know how to cope and know the
yeah.
mechanisms there.
I think because I work with women now and I have done for the last 4 years predominantly, I think it's become, and it has a hot topic. So we've now got like groups going and things like that. And because they've all got laptops in the cell, we put things on the laptop all the time, just making them aware of who to contact, how to contact. But then we
Okay.
touch base with them. We do a
mm,
lot of work around it because I feel like
mm,
there are vulnerable women, and once they leave us and go out to the community,
mm.
we just want to make sure that they're forearmed and forewarned as to what is going to happen, how to look after themselves as best they can. But like you say, if you don't talk about it, people just think, you know, what's going on, don't they? Anyway,
Yes.
so I think it's just, you might as well just
And
talk
the
about
other
it.
thing, because we work in a male environment. Nowadays, I hear from the women, they say, "Oh, thank God, my boss is old enough. His wife is already menopause, so he understand. He understand." Yes, I hear that a lot of women. They say that. Thank God, his wife is also menopause, so he understand what is menopause about. Because most of the bosses are men, and in the past, when I was even a registrar. I was not menopause. My boss was anything you did a little bit. He didn't like it. He said, "Oh, woman is hormonal." Even
Oh
the period
God.
was a problem for. So, but now they can't say that. They can't do that. So in that time, everything was hormonal. Either you have a period or you're pregnant or this and that. But nowadays, all of them, they are being educated also. The men are
Yeah.
educated. Yeah. So that is also affect eventually how the woman can raise this concern and how the woman can behave and say, because I am menopause. Yes, there are little, I can say 1%, they exaggerating and also they use it as a weapon to take time too much off or some, but 99% of the women, they have a symptom, they have a problem. And nowadays, as you said, you have a cafe at work. So most of the companies now, they know what is menopause about.
Yeah, it's all about work-life balance, isn't it? You've got to be, if you're honest with your bosses and upfront with your bosses and they know where you're at, you know, I said to mine, you know, if I'm a little bit late, it's because I might have, you know, not slept properly. And they know, I just tell them where I'm at, what's happening, and what to expect, so there's no surprises. No surprises, no point.
Absolutely, and also encouraging the education culture, even in the workplace. Honestly, because I'd worked somewhere where we were actually pushing for, you know, that kind of, you know, when you do like your quarterly training and all of those things, make sure that that was included, that, you know, men are educated and informed about some of these things, so that you're someone who's land managing you is male and he has no clue what you're going through. Maybe he's also younger than you and all of that, you know. So just finding that, pushing that education, especially in the workplace, so that women are not made to feel incompetent or like something's wrong with them if the symptoms of menopause is what's affecting them, you know. You know,
But you also then have to educate and discuss it with your family, because if you've got males in your family like sons and things as well, it's just, you don't have to go into loads of detail, but it's about just letting them know just something so that they can understand where you're coming from as well. Because I think, you know, if we don't educate our sons and
that's
daughters,
right.
then we really, you know, we have to just keep being open about it.
Yeah.
Absolutely. Absolutely.
And the other
That's
symptom, which is very, very common and very wrong understanding, is the bladder symptom. Bladder symptom, most of the women, they go to the GP, they phone, you know, this e-consult, they phone and they give them antibiotic. For a while, it's fine. Then a week after, they have urgency, frequency, burning sensation, and then the urine come back normal, and the GP is not accepting any more antibiotic because they just felt, because it's the inflammation. Is a lack of estrogen. Is the lack of estrogen. When they come to me and I say that, they say, "Oh, how come?" I say, "Yeah, because blood and vagina is very near to each other, and they both affected by the same hormone. So the urgency, frequency, incontinence, and also lack of libido, dryness. These are also very, very common, and it is much a little bit later when it is completely diminished. The estrogen is diminished, then they have, but they go to urologists, they go to the GP, and they go round
I
with
can
many
imagine.
antibiotics. But eventually, it is the estrogen deficiency, it's nothing else. And they take, some people, they don't want any hormone. Fair enough. This is their choice. They don't want any hormone. They're afraid from the hormone, or they can't take it, to be honest. Some unlucky people, they can't
Yeah.
even take
Yeah.
it. So there is moisturizer, not lubricant, moisturizer, which is available in most of the pharmacy and booths. So it is very good to use.
So is that
Emollient
estrogen
is very
moisturizer?
moisture.
What's that?
It is called Yes or Silk, SYLK, or Yes, YES. Is very good for like nourishing the area, and even for the bladder if the hormone is not accepted or not allowed to take. It's very good every day. It's natural, low, it's all water based, and they can use it. And also cutting down again coffee and tea and fizzy drink and alcohol to not affect the bladder. So these are the things which is just natural, unless if nothing is helped, then we give them hormone.
Right. Right.
Yeah.
Okay. So I wanted to touch a bit on the hormone therapy or what other therapy
Mm,
there
mm,
might be there. So first of all, let's talk about the HCR, because you just mentioned that
Mm,
some
mm,
people are not on it, and some
mm.
people it's because they can't even go on it because they're.
No.
So tell us, the
Yeah.
advantages, disadvantages, and which people can take HRT.
HRT is, as again, it is individual. There
Mm-hmm.
are
Mhm.
people with the cancer whom they are hormone positive, they cannot take the HRT,
Mm-hmm.
especially breast cancer with a hormone positive, or any other cancer which is hormone dependent. So if it is hormone dependent, unfortunately they can't. But there are other things you can give. But the rest they can, but has to be patient, because HRT is not going to be within a week the woman feel completely different from the week before.
Oh,
It
okay.
takes they take 4 to 6 months to feel. Yes, there are symptoms can be resolved within
Really?
3 weeks, 4 weeks, but full effect is take, especially if you take it later. If you take it very early in the beginning, is different from the later.
Okay.
But it is take 4 to 6 months, and the early days can cause bleeding, especially up to 4 months. I mean, gynecology say up to 6 months, but nice guidelines saying up to 4 months.
Right.
So any unusual bleeding can be acceptable. Any not resolving the symptom can be acceptable, and they can take it. And to be honest, even they are hypertensive or diabetes, as far as well controlled, they can take it. Even if they have a clotting, it's different from one person because we have different type of hormone. Lucky now we have a tablet that is for postmenopausal. We have gel and tablet has to be taken combined, or patch. Patch is easy, 3.5 day, 3.5 day, they can change it. It has doses, it has levels. We have always to start with a small dose.
Mm-hmm.
And then if they are okay with a small dose, carry on with the small dose. If they are not, then they are medium dose, 3/4 higher or higher dose. And also, there are a tablet which also depend on the women if they have a uterus or they don't have a uterus.
Mm-hmm.
If they have uterus, they have to have a support from progesterone. Progesterone is for support. It's not it's not by itself is HRT. Estrogen is HRT, but the progesterone is a support for the line of the womb, line of the neck of the womb, to avoid exaggerating because it proliferate and may change to something serious if you take a long time.
Mm-hmm.
But if they have no uterus, free. You have estrogen. You can take it as a tablet, you can take it as a gel, you can take it as a patch, whatever you want to take it. We don't need progesterone.
Okay.
And then,
I have one question for you,
yeah,
Dr. Ma, before you carry on.
yeah.
So,
Mm,
how do you? Is the only okay? Let me rephrase.
mm.
Okay, for women who, how do you decide that it's okay for a woman to have HRT? Is it just by asking her if she's got history of cancer, or is there a test that can be
We
done to
ask,
say, okay, she
we ask
qualifies or she
all,
doesn't qualify?
we ask always the herself if she has any cancer or not, or any hormone. Even if it is no hormone dependent, still she can. And family history, this gene positive family, close relative. Basically, the only risk with the HRT is increase the risk of breast
Breast
cancer
cancer.
by very minimum.
Mm.
And the women which take in HRT, they are very aware of that. So they examine themselves much better than the woman is not on HRT because they know that there is some risk. So the increase in risk, basically, risk of breast cancer as a general population, if they don't take any HRT, is 15 per 1,000. But if they take HRT, become 19 per 1,000. So 1 in 200 is increase. 1 in 200 increase. It's not that majorly high. But if they are BRCA, maybe the gene positive, very strong family history of breast cancer early life, because most of the genetic predisposition is they get cancer below age of 50, and either breast cancer or prostate or bowel
Mm-hmm.
cancer. These are quite related to each other. But still there are women, they say, I can't live. I want to live. If I don't live properly without, just because I'm not allowed, what is the difference? I want to live and I take a risk. There are people still taking, even there is a risk, but they have mammogram. And most of the people, when they take from even NHS from age of 50, nowadays anyone have insurance, they have very health check every year, so they have a chance to do, and even examination. Unless if it is a severe, for example, severe heart disease, which is predisposed to a lot of clotting. And the clotting also is not contraindicated to use a gel or a patch. It is better not to use tablet, because there is a tablet which is used. The tablet can increase risk of clotting. If people have clotting, still you can use patch and gel, because they are bioidentical. It's like how your ovary was producing. Up to 10 years ago, it was from horse urine. The HRT was made from horse urine. That was not bioidentical. So it caused a lot of problem. But there is also loss of libido. We asked quite a lot about this, and there is a gel also, but the gel is not licensed for women. But we still use it, and it is testosterone, a small dose, but not for exaggeration. But we tell them there is a risk of, not risk, I mean the disadvantage of it can increase facial hair growth or mustache or chin or things like that. They accept it. A lot of women, they like it. Some women say, I haven't seen any difference, so I will stop it.
Okay.
Yeah.
All right. Also, I wanted to ask now. So this is, for me, thinking about what you're saying is in two parts. Okay, for instance, if you choose to take HRT, because remember with menopause, you're also trying to reduce the symptoms or alleviate the symptoms, is why you must change lifestyle, eat well, and take supplements if you have to. But there's also the bit that you're trying to, because you remember that estrogen is depleted, is why you're trying to top up with estrogen. So if you're not taking HRT and you have a good, you're living well, you're eating well, you top up with supplements, let's say. So what is the situation for that kind of person? Because there's nothing that you're taking to if you like top up your estrogen.
If the woman have no symptom with the lifestyle, sorry Paula, if the lifestyle is okay, vitamin D, calcium, exposure to the sun, because that's osteoporosis is very, very common in postmenopausal women, and that's why the neck femur fracture was quite common in the women. When they fell anywhere, they get fractured. So you have to be careful with that. And if they say, I'm fine, my symptoms all okay, I don't need the HRT, that's their choice. Yes, it is the question of it.
I think we've got to put it down to choice, because I mean, I am postmenopausal.
Yeah.
Has been for about 3 years. I don't take anything at the moment. I feel very well for not taking anything. I have had a break, but I was roller skating 4 years ago. I broke my ankle, but I do some weightlifting and things like that, because I do believe we can improve our bone density by doing, movement and things like that. So I think that it's that thing, isn't it, about choice and balance, isn't it?
It's
one of those that
all choice. It's all choice.
Absolutely. It's all choice, your choice. But I wanted to check with you, Paula. So what did you take the perimenopause and now postmenopause?
So I used to eat soya, like the doctor was saying, things with soya based things in them. Just the ashwagandha to help me through. Vitamin D. I did take magnesium because I was having restless legs, but I also increased my greens, like the spinach and the kale. And then I did have a Dutch test done, which is a really It's just a really good test to look at your hormones. I did that
What
2
test
years
was
ago.
that?
The Dutch test. You have to pay for it. It's a private test. I wanted to do just to have a whole holistic look at what I was dealing with. And they just from that, they just said you could put in Tribellis, Rhodolia, and Shatavari. And I have tried those 3 supplements, but I can't take one of them because you've got to remember, if you're taking supplements, you've got to look at your blood pressure and things like that. And I went to work one day and noticed my blood pressure was really high, and it was because I was taking the Shatavari. So I've taken that out, and I'm good with the Rhodolia and the Tribellis as a supplement form. But I just had, like, you know, the fact you can buy the flax seeds and things like that to incorporate. But you've got to be careful how much estrogen you take as well if it's natural. Everything's in moderation.
I know, but so how do you know the moderation? Because now what you just said about what you couldn't take and what combination of what might be causing high blood pressure, because I've never one with high blood pressure, but in the last month or so, and I've been having high blood pressure. I'm like, what has changed? What is going on? You know, now that for me is like, okay, that might just be something that I've overdosed on, because I'm trying to do all of this many supplements and this thing, and
you've got to look at what are you taking. And then when I went to work that day, people saying, God, how are you still walking around? Your blood pressure. And then they had me worried. They were like, so we were doing a health and well-being day as well. And I'm like, so I did it a couple of more times and it started coming down. And I just thought, I went and had a look at it and thought, well, the only thing I'd taken that morning outside my norm was the Shatavari. And I can take it, but I've got to take it in very, very small doses. And it was really good for my nails and things like that. It's an organic powder, but again, it's about then checking on your other statistics, isn't it? Like your BP, your temperature, just looking at what else is going on for you, because you don't want to be just taking things willy-nilly without checking on just your baseline statistics.
Yeah. Diabetes, blood pressure, heart problem, thyroid problem.
Thyroid,
because some people, they have thyroid problem and it's not menopause. So you check them and you say, oh, this is the problem, and they treat themselves, and that's fine. So it is different. Not everything is menopause. That's what I always first thing the women come, I say, I go through what is not menopause, then I go to the menopause. Yeah, that's important, because you will be responsible if you label the patient with a menopause and there is other thing which they don't know. You have to highlight it for them. You have to tell them.
So really, it's getting the balance, really, even if you want to go natural, is finding the balance, because you don't know what you don't know. Now it's only because you've talked about this high blood pressure and what you were taking or you had to stop taking, because I couldn't figure out why all of a sudden my blood pressure was really high. I'm thinking, I'm not one with high blood pressure. Okay, maybe I've been stressed lately. Okay, I'll rest. And then I'll sleep most of the time. And I wake up in the morning, my blood pressure is really high. Like, what am I doing now?
Supplement. Supplement, that's the problem. You have to know what you're taking and read the small things. Read the small things, see, because maybe they are so much sodium in, it's over the top, and you don't know. You don't know. And you are sensitive and your blood pressure will go up. So you have to be careful. Supplement, I'm afraid from supplement. I personally afraid from hormones also. But yes, I afraid from all hormones. But I agree with the patient, because sometimes they ask me, do you take it? I say, don't ignore me. Don't talk about it. You are the one I'm dealing with. You are the one I'm dealing with. But I'm not against it. I say just ignore me. I am not against the menopause treatment, but just you have to be careful.
And that's because I work with, like I said, vulnerable women who do a lot of substance misuse, and so we have to deal with another sort of like you've got your crack, heroin, alcohol, they inject, they do all these different things. So we try to get them to think about, because when they're with us, they're not doing that. So we get them to try and think about holistic stuff. And then if they need HRT, then yes, that's down they've got on the GP route. But we do a lot. We try to do a lot more holistic stuff, which is like yoga. Exercise, meditation,
Yeah.
relaxation. You know,
Yeah.
it's all about bringing themselves back down. You know,
Yeah.
you've got to bring your nervous system to a point where it's baseline again, so that
Yeah.
when you're talking about what you're feeling, it's what are you feeling? Because you know, once you're not having any substances in the body, you're going to feel a lot more different things. You're going to actually feel what life's about, and some people don't want to feel that.
Yeah, and that brings me to another question. So this alternative therapy that's called CBT.
Yeah.
What's your thoughts about it? This cognitive behavioral therapy. You know, apparently it's just an effort to change our thinking pattern. But how? Anybody tried that? How has that helped? Do anyone know anything about that?
I
I've
personally
not tried it myself.
no.
I've done it with people, but not for menopause. I've done cognitive behavioural therapy for people who are going through periods in their life where it's probably stressful, or they've got anxiety issues, or they want to deal with something specific. But in the menopause arena, that's not something we've used for people, because we tend to go with more the things that they can do in cell by themselves, which is the yoga, the meditation, relaxation, thinking about positive things. I was not saying don't think about the negatives that happen, but trying to enforce positivity within. Yeah, so I've not used cognitive behaviour therapy for people with menopausal
Yeah.
symptoms.
So
Can be
I've been to.
used. Can be used.
I've been.
Yeah.
Have you? After Dr. Omar, because I've been
No,
to.
can be used. Can be used. Can be
Yeah,
used.
because I
Yeah.
know I've been to a workshop, menopause workshop before, and some speaker who came, and that's what she uses for her
Mm,
clients. You know, the
mm, mm,
CBT, and
mm.
apparently some people say it's
Yeah.
worked for them.
Yeah.
Yeah,
Yeah.
again,
Relaxation and hydration. And some people, they don't understand smoking and vape is very damaging. They think vape is very good nowadays. Even the government talk about is worse than smoking, and God knows what is inside it. And they test, the vape when 2 out of 8 have some substance which is not good for the body, and it is not, and you don't know which one you're taking. So yeah, relaxation, yoga, Pilates, all those things is very important.
All
Yeah.
right. So our time is fast spent, but quickly before we go,
Mm.
um, Paula, two things you would like to debunk, about common myths about menopause, one or two,
one
and then you
or
too,
two.
Dr. Omar, please.
Well, I think it's that. I think it's one of the common ones that people forget. Do they need to take contraception in perimenopause, going into the menopause? And it is, yes, you do. And even when you become post, you've got to take it up to a certain time after you've had your period, because you've got to ensure that if you don't want a baby in your later life, if so that's one way people think you can't get pregnant. But
You
hey,
still protect yourself.
yes.
Mm.
And I think, what's the other one for me? I think it's the one where living well. I think the myth is that you've got to. I think people think the myth is that you've got to be. How can I put it? I think we shouldn't generalize and say, oh, if somebody's out there saying they're really struggling. I think we've got to break down the myths of this thing where people will think, oh, because you're really educated, you understand what the menopause is about. So I think we've got to break down this myth as well, because I used to work with a psychologist, and
Right.
she was included about the menopause. I think we've got to think about it as a broad spectrum of people and educate everybody, regardless of whether they've got a degree or not. Because not everybody knows about, people don't always take time to notice what is the menopause or what are they going through. So I think it is
Yeah,
about, let's educate everybody, regardless of your status.
absolutely. A-
Mm.
Absolutely. Thank you for that. And have you seen the list of different symptoms? People have different symptoms. So
Mm.
it's
Yes,
endless.
yes. It's,
Mm.
Sometimes people have things you've never heard before, like, oh really? Is that menopause? So yeah, absolutely. I agree
yeah.
with you. Thank you for that. Dr. Omar, what's one myth or
The
two
second
that you
thing,
would like to
first,
debunk?
yeah, first, make sure that no other things which is affecting this symptom to happen is really mostly it is menopause. Nothing else is going on. And yes, we are all stressed about work, this. We can't blame always the menopause about it, but make sure that there is nothing else which is related to your symptom it is purely menopause. Otherwise, menopause management is not going to help. And be patient. Be patient with if you trying to treat the menopause, whether it is natural or it is hormonal, try to be patient because it takes time. The second thing, the people who can't take HRT because they have like no indication or contraindication to take it, there are many other things they can take. Just go to your GP or doctors or whoever specialist, they can help out, because some people, they can't go, they say, "Well, there is no, I can't take the hormone, so there is no other thing." There are something which is very important for each symptom they have.
Amazing. Thank you so much. So
Thank
what will be
you.
the last word, something you would like to leave with women so that they can embrace this journey of menopause and live it confidently?
Be confident. Talk about it. Raise the concern. Don't listen to the people say, "Oh, that woman is hormonal." We are in a male environment working. We are much stronger. We can do too many things in the same time. And we did it. You looking after so many things in the same time. And don't give up. Don't give
Yeah.
up.
And
Awesome. Amazing.
Never.
Amazing. What
I
would
think
you
to
what
add,
would you leave with women,
I think to
No.
Paula?
add to that is wear colours that are going to be vibrant. Don't sort of like hide away in the shadows. Wear wear some lovely colours. Dress up, just dress up daily for
Yes.
yourself, and
Pink,
ensure that
baby
you
blue, pink, white. Yes. White
make sure you're
dark. White blue,
hydrated.
white,
Make sure you're
white
also
dark.
getting lots of rest.
Yeah.
Get your rest, and
Mm.
if you've got family members, share the load.
Yeah.
Just delegate things.
Mm.
Make sure everybody else is on board to be doing their
Yeah.
bits, so that you can actually
Yeah.
have time for you.
Yeah. Have your time. And galley holidays, which is good also. Galley out.
Yeah.
Get out in
Yeah.
the fresh air. Use what
Yeah.
resources you have.
Take your life.
Fresh
Take
air.
your life.
Get out in the
Yeah. Sure.
sunlight when it's bright in the morning. Things like that.
Yeah.
Yeah,
Yeah.
we don't have a lot of that
We don't have a lot,
in the
but we have
autumn.
to
In the
take what we
autumn,
get.
but
Yeah.
we take what we get. We
Yeah.
take what we get. Amazing. It's been lovely. And one thing I like to add also is, this symptom checker. Honestly, have it handy when you go and speak to your
Yeah. Yeah.
healthcare provider, just so that you haven't forgotten some of the things you're feeling.
Yeah.
So that you can get the right help and get the right if you like medication or whatever is going to be prescribed to you. Honestly, personally the symptom checker I think
Yeah.
is a thing to
Yeah.
always have
Yeah.
handy.
Yeah.
Really. And thank you, ladies. It's been
Thank
amazing. We
you.
just
Thank you
chatted
so
away
much.
and forgot the time, but it's been lovely
Yes.
talking about
Thank
this.
you.
Amazing.
Thank you so much.
Thank you, ladies.
Thank
I
you.
really thank you for
Bye.
your time. Appreciate
Good
it.
night. Have a
Thank you
nice
for sharing.
weekend.
Have a
Bye.
lovely,
Bye.
lovely
Bye.
evening.
Bye. Bye.
Thank you,
Bye.
Paula. Bye. Thank
Bye.
you,
Bye. Bye.
Dr. Omar. Thank you. Have a lovely
Thank
evening.
you. Thank
Good
you. Bye
night.
bye. Bye.
Good night. Thank
Good night.
you.
Bye.
God bless. Bye bye.